guys, welcome back to Medical Coding with Blue. Today's episode is all about how to explain gaps in your resume as a new medical coder and some other tips for your resume. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, before I get into this episode, I am a professional resume writer. If you are interested in booking a session with me, my rate and contact information is in the description box below. I will say this though, my calendar is currently booked and I do not have any availability until after April the 1st, 2024, just so you guys know, okay? So with that out of the way, if you have a gap in your resume, sometimes this happens in life. People will stay at home to raise their children, or maybe there was a medical issue, or maybe they were taking care of a family member who had a medical issue. There's a myriad of reasons that people stop working, and there's gaps in their employment history and things like that. But the thing that you have to understand is this: when you are applying for a job, and the reason that I guess, gaps are such a big deal is because they want to know about consistency. And if there's a large gap in employment, okay, well, what was this person doing? It's not like you weren't doing anything if you were being a caretaker to children, or if you were being a caretaker to an elderly parent or another relative, or if you had a medical condition and you were taking time to heal and take care of yourself. These are all valid reasons to be without work, technical work, right? Like a paycheck, right? But the thing is, you can explain this on your resume. If you were a caretaker, you can put caretaker, and then you could put the time frame that you were this caretaker. If you were a stay-at-home parent, it's when you started having your family, and that's when you can start putting that down. And then you can say all the things that you did. Obviously, as a caretaker for children, you're having to make sure that you keep the house stocked with the right food and nutrition and things like that, and that you were managing the bills and things. And even if you're not managing the bills, if you're still going out shopping, like for groceries and things like that, that still counts. If you're keeping track of the receipts, again, that still counts. That's still record keeping, that you're having to keep all of this information, together. You obviously have to, if you didn't do that, right? If you had to keep track of the children's allergies and things like that, any kind of surgeries they had, or even your spouse and things like that, you don't have to write down the details, but you can just say that you kept that information up to date. And so that's something that, you can include that on your resume, that's what you were doing at the time. I do recommend putting it in bullets, so that way it doesn't look disorganized. It's very clear and cut what we're looking at here, because no employer wants to see a big paragraph for every single job that's there. And the other thing that I should mention is this: your resume, your job history should only be going back the last 10 to 15 years, okay? 15 is a little long, but 10 to 15 years, that's the last kind of gap gap of time that you need to be looking at. So from current to the last 10 to 15 years, okay? If you worked in the early 2000s and the 90s and the 80s, we don't need to know that. We don't need to know every single job that you had, especially when you're getting into medical coding. What you need to have on your resume is what you were doing and how is it relevant, okay? Obviously, keeping track of, your family's medical history is very important, right? But it also says that you can keep information private. That's something that you have to really think about, because believe it or not, we still keep information private and safe, right? If you were a volunteer with the church, and let's just say you were collecting the donations from the churchgoers, you were handling money. Sometimes when you're starting off in medical coding, sometimes you can't start off there right away, and you get your start in medical billing, because that's the first place that you can find a job at. Well, you have cash handling experience just working with the church, right? Even though you're not drawing a paycheck from the church, you can still identify on your resume that you were a volunteer with your church, okay? It's the same thing if you taught the Sunday school, right? If you did that, if you were a volunteer with the Sunday school, that you helped to guide, young people or even adults, if you did the adult catechism, right? That, you helped them in their different learning styles. that's something that you can also put onto your resume, okay? Some people do volunteer work with the PTA. I've seen one of my clients was very successful with that. She was a stay-at-home mom. I asked her, is there anything else you did? Were you with the PTA? Were you with the Girl Scouts or any of those things? She said, well, I did the PTA. So I added that to her resume along with the fact that she was a caretaker, and that was what got her in, you know. So it's all about how you word these things and what you're doing. You really have to think about what you're doing, because when you're not working, you're literally not doing nothing. You have to be doing something. There is something that you're doing. And if it is that you are studying during this time, that you don't have a family or kids or anything or nobody to take care of, you're just kind of like living life and you're just kind of like trying to figure out what to do, and you're like, oh my gosh, and I haven't been working, I haven't been doing this, but I've had somebody to take care of me, but now I don't know, but I guess I'll just study. Well, you can put that on there as well, that you were doing that during that gap in your employment. So that is something that you can put onto your resume, so that way they can identify what you were doing during that time. And remember, all you need to do is go back 10 to 15 years, and that's it, okay? You don't have to fill in everything. But just have those gaps filled in and let them know what you were doing, right? Obviously within reason, you know. But that's the thing that you can have there. Not all of your experience has to be where you're earning a paycheck, okay? It just needs to be relevant. What did you do that was relevant to this job that you're going to apply for? Because if that's your focus and that's what you want, how are you bringing some transferable skills for that job? Right? So that's something that you can think of for your resume. And your resume only needs to be one page. It does not need to be multiple pages, okay? If you have a 3 or 4 or 5 page resume, that's where your biggest problem is coming into play, because no hiring manager is going to take the time to look at your 4 or 5 page resume, because you clearly don't know that that's unacceptable etiquette when you are in the applying, when you're applying for jobs. So just keep that in mind. You want to make sure that you are doing the things that are going to get you the most success and the highest probability of being able to be called. Okay, so that I will say there. The other thing too is this: if you have gone to college and you did not complete your degree, whether it was the associate's degree, whether it was your bachelor's degree or any of those things, if you went to college and you have not finished and you basically left because you don't want to do it anymore, but you know, you think it's good to have your that you went to college on your resume, my strongest recommendation is to get that off of there, because it's misleading. Okay, number one, it's misleading. Now, there are some employers that love the degree holders, and it doesn't matter what the degree is in. They love degree holders only because this says that this person has proven that they can go to a place consistently for 2 years or 4 years and to be able to follow through and complete what they started. Okay, that's what a degree says. That's why some employers, they're okay with you having a degree. It doesn't necessarily have to be what they need, but it just shows that person's work ethic, you know. However, I will say this: do not think that you have to get a degree in order to get a job in coding. The only reason that you should pursue a health information management degree is because you want to be in leadership. That is why. It does not get you more money. It does not get you hired faster. I know, because I'm the one who hears from the chorus of people who spent thousands of dollars on a degree thinking that it was going to get them more money as a coder, and then to find out, sadly, that it did not. And then they're just still so confused and disillusioned as to why. Well, because those degrees are designed to be our leaders. If you are not fully getting into the position that those degrees are designed for, you're not going to see the fruit of those things, right? Because technically you are working under what you should be if you have an RHIA and you're working as a coder. Now, before you say, well, at my hospital, we only hire degree holders. I know that is not true. Trust me, I've seen that job listing several times where they say that a degree is okay but they really want the certification. And sometimes with degree holders, they expect them to also get a certification because this says that they are proficient in the coding portion. Now, why do they do that? Again, because for the 57th, 11th time, the degree holders are designed to be our leaders. If you look at the syllabus for any of these degree programs for health information technology, you will see that the majority of what is covered in that program is going to be about managing people, ethics, statistics, and that kind of thing. That's the laws. That's what those degrees are designed for. The coding portion of those programs is very small, okay? And the RHIT obviously it's supposed to be the technical side, but there's a lot of people that have said that it's not as much coding as it used to be, okay? So, I'm just saying. So if you are really seriously considering a degree, because again, maybe somebody told you that you need a degree to get into coding, that's just not true. And as I've said, if you are going to just throw your money away, not really knowing, because you may get into it and decide that you don't even like it. So then guess what? You just threw away thousands of dollars in a student loan because you wanted to get all this money, and then you're not going to make it because you don't really like it. So start off with a coding certification so that way you can at least get your foot in the door and see if you like it. And again, if you follow these simple steps on these resumes that I give all the time, right? I give you all these tips. Use these tips and help it to improve your resume so that way you can get your foot in the door. Because this resume is what the employer sees first. Not you, not your story, not anything else. It's your resume. And yes, you do have to have this. It does need a professional objective. Do not argue with me because I always get somebody that wants to get fresh about this every time I say it. But here's the thing, guys. I tell you, you need a professional objective because this is going to tell the employer, the hiring manager, what you're there for. Do you know a lot of times these hiring managers get these resumes printed out, these resumes and cover letters printed out for them, but they're often handed just a stack of the resumes and they're just looking through it. And if you're not saying what it is that you want to do there, that employer may be hiring for a bunch of different positions all at the same time. They are not going to take the time to try to figure out what it is that you want if you're not specifically saying on your resume what is the specific job title for that organization that you're applying for. And yes, it does require you to update your resume quite frequently, and a lot of people will complain about that. But do you want to get your resume noticed? Because again, it's going through these software systems that are just looking for words. So again, you have to give it what it's looking for, and if it's not recognizing, then obviously you can instantly get a rejection because you didn't put on there what the job listing is asking for, or even what job are you looking for. Okay, so you want to make this as quick as possible. If this hiring manager gets your resume, you want to be able to have it speak for you very clearly and concisely. What are you looking for? Okay. And so that's what you have. That's my other tip, right? Is being very clear with an objective. All right. On your skills list, I've always said this on the skills list too, is I don't ever want to see organized and team player on your skills. Never. Because again, guys, those are soft skills, and that's what you talk about on your cover letter. Okay, that's not what you talk about in your skills, because your skills is your hard skills. Okay, and do not copy that huge long list that I see floating around out there on the internet for medical coders, because again, if I see that, that's an immediate rejection on that resume, because again, that's just doesn't show that you know exactly what these employers are looking for, even though everything that they're asking for, the skills, is going to be in that job listing. Okay, so if you did not complete your degree, okay, getting back to that, if you did not complete your degree, then you do not want to include that information on there. If you are still in the program, let's just say that you're going for your RHIT and you are expected to graduate in January or June of 2025, then you can put on there health information technology expected graduation June 2025. Now that tells the employer, okay, this person's still in school. Okay. But if you are just putting on there that you have a degree, and anytime you see a degree on there, they're going to think that that degree is already completed unless you say expected graduation date. Okay. But if you did not complete it, or you say, well, I'm going to go back and complete it, then you need to have an idea of when you're expected to graduate. But if you are not intending to go back to school, then you need to get it off of there, because that's misleading when you say that, oh, you know, you're pursuing health information management, and you say, no, I just decided not to pursue it after a while, but I'm just going to put it on there because I went through all the classes. No, because then they're going to think, oh, okay, well, this person is either going to get their RHIA, or they're going to be sitting for it soon, or when are we going to see this person graduate? And they may even ask you, you know, when are you expected to graduate? And you don't want to sit there and say, well, no, I mean to go back, and I'm going to go back. No. It needs to be clear and concise in what you do. But if you are expecting to graduate soon, you're not graduated yet, then you could put your expected graduation date, okay? And it can be an estimate if you're not really sure, and that's okay. But if you're as long as you're actively in school, okay? But that's just what I would say there. The other thing that I want to mention before I wrap this one up, obviously, is make sure that on your name, and this is the most basic thing of anything that I have seen, but I see a lot of people make this mistake, even on LinkedIn when I see this, is they have just their name. They don't put their credentials. So if you have a CCA, CCS, CCSP, or CPC, CPCA, they don't put that there next to it. What are you doing? What credential do you have? You know what I mean? So you need to put a comma, and then you need to put your credential or credentials next to your name, okay? So that's very important, because that identifies you right away. And we are supposed to clearly identify the credentials that we do have in professional correspondence and in our resume and things like that. So you want to make sure that you do have that on beside your name, so that way they can immediately identify what credentials you do have, all right? So always be clear with that. You know, that's the thing that you want to be, you know, very straightforward about. But resumes, again, they're going to be your mouthpiece. And when you talk about like your gaps and things like that, if they ask you, you know, why do you have this big gap? And you've explained on there that you were a stay-at-home parent and, you know, you did those things. It's not necessary to go into all of the details and then to show pictures of your kids and be so proud of things like that, because you don't want to distract them with the fact that you are a parent, okay? You need to redirect their focus on the fact that you are a new medical coder and that you're trying to get out there because you're very excited to share your knowledge. What is it that you are going to be doing for them? Because I've said this before, I gave an example of, you know, the two people that are in the job interview, and one person is asked, you know, tell me about yourself. And then they immediately want to start talking about their kids and how happy they are and proud of them, and they're going to go off to college and do all these things. And meanwhile, the other candidate who has the same, you know, coding credential and the same education, so they're both brand new and they're starting. The other person who mentions that all the things that they've learned in the school and all of the excitement that they've found by learning medical coding, and maybe they have children too, but they didn't bring it up because of the simple fact that when they're asking you to tell them about yourself, they're not asking for you to sit there and show them pictures of your kids. Now, again, you may be proud of them, and there's nothing wrong with that, but in the interview, in the job interview, you want to pick the candidate who's most with it and is going to show the most promise of focus and drive for this position, because they cannot discriminate against you because you have children. However, they will try to pick the candidate who shows, again, the one that's going to be there, the one that's going to focus the most on their job, because at the end of the day, it's about the employer. It's not about the individual. It's about the employer. And that's what they're looking at. They want the person who's going to be the most beneficial to them, because they have to make this decision based on very little information, just based on barely what you're telling them about yourself, what they can find in a background check, and all of these things, and from your resume. So they need to know that you are, showing honesty, that you're showing consistency, that you are showing enthusiasm for the work, and not that you're going to get so easily bored, or that you're going to be constantly like, I'm distracted with my kids, and my kids are little, and here they are, or my kids are grown, and I've got to help them, and all these things. And while it may make for a good excuse for you to be working because you need to help your grown children, it's still not going to be the thing that's going to stand out and be the wow factor for the employer. It's the person who's showing excitement for the industry and for getting started and things like that, and that curious mind, asking about the organization and being a good back and forth with that conversation, and not just focusing on me, my kids and my family and all of these things. It's going to be about that person's curiosity about that employer. Okay, so that's the thing that you have to know. That's going to set you up for success. And I've seen other entrepreneurs that they help people get hired and things like that on Instagram. And Anna Papalia is one I follow. But she talks about a lot of those tips, and she works to help people do those things. And that was one of the things that she said as well, is that, they can't discriminate against you just because you're a parent, but they are going to be looking at your responses. Okay. So that's the thing that you need to know. All right. Again, it's just meant to set you up for success. If you take my advice, don't take my advice, whatever, but, that's the thing that when you're out there, you should be aware of. This is a different kind of industry. It's not like health information is just a different industry altogether. There's a lot more nuance to it, and there's a lot of other things that you don't get to learn in the school. Okay, so everything that I share here is what you're not learning in the school, and so hopefully it's going to give you that competitive edge if you follow it. Okay, 1-page resume, state your credential that you got. And the other thing that I will say before I get into the end of the video, if you have not taken your CCS, if you're not taking your RHIA or your RHIT or any of those things, do not put RHIT candidate, RHIA candidate, like you're trying to include that on your credentials and things like that, or a CCS prospect or candidate or whatever. Don't do that. Because again, it's very misleading, especially if the person is looking at it very quickly, thinking that you're already certified. I've heard of that too, where people will say, well, I put on there, that I was expecting to get my CCS, on this date, and they thought I had my CCS, and they brought me in for an interview, and I told them I didn't have it yet, and they told me that, well, we can't hire you. So don't do that. If you do not have your credential yet, CCS, CCA, CCSP, or CPC, or RHIA, or RHIT, if you do not have it yet, do not put it on there that you are pending, or that you are about to get it, or, whatever the case may be, or candidate. Do not put that on there. Again, because again, people will look at things very quickly, these hiring managers included, and sometimes they may miss that. And again, it's very misleading. So you don't want to waste anybody's time. And if you're getting out there and you're saying, well, I'm applying without a medical coding credential, sometimes employers will take a chance on you. But again, you need to be very honest in your resume about what knowledge you do have. So if you've completed a program for medical billing and coding, you can always put that completed. Okay. If you got laid off, or if you got furloughed from one of the other jobs, big employers that, laid off a bunch of people or whatever, or furloughed a bunch of people, you can also put that on there, furloughed as of, okay? So that way you can account for that time as well. So that's just something that you should know. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.